Now, what are some of the preventative measures that we can take to not, of course, succumb to skin cancer and have the start of it? Of course, wearing sunscreen is a major one.
It is, and, not, and the type of sunscreen is very important too.
Really? Oh,
The
okay.
SPF number should be 15 or above. 30 is preferable in an individual with a history of skin cancer. But I prefer the main ingredient in the sunscreen to contain either titanium dioxide
Okay.
or zinc oxide. And the reason is that those are inert ingredients. They're not broken down by the sun like chemical-based sunscreens, and they tend to last a lot longer.
Okay, wonderful. That's definitely some things we can do.
You can. The other thing is avoid tanning. I
Right.
don't recommend tanning booths for any of my patients. Uh, do activities either early in the morning or later in the day.
Mm-hmm.
Overall, it's moderation. Enjoy yourself, but do it in a moderate manner, avoiding any excessive sun.
Absolutely. And if you are, we do live in Florida and we live in a community where there are fun things to do during the day, like golfing and tennis and things, but it is using things in moderation, which means putting sunscreen on a lot.
Absolutely. In fact, I encourage all my patients to stay active and healthy. But if they are enjoying golf, I'll tell them after 9 holes, right?
Mm-hmm.
As you proceed, go ahead and reapply the sunblock, or after some tennis, after an hour or two, do a reapplication, because most sunblocks, they may say that they're sweat proof, but many will need a reapplication after an hour or two.
Absolutely. Now, we've covered part of the dermatology practice that you do. Of course, some of dermatology encompasses cosmetic, which brings me to the point where when I go out in the sun, for instance, I get like some brown patchy spots on my face or my skin. Now, you have laser resurfacing that can actually help things. You have other procedures that can help things like that, don't you?
That's exactly right. The trend has been in my cosmetic practice. Patients seem to prefer to do things with less downtime, less risk, less invasiveness, and some of the newer technology, including pulsed light treatment, which is a type of
Mm.
laser, is a wonderful treatment where we can treat individuals for brown spots, red spots, acne, rosacea, fine lines and wrinkles, even shrink
Wow.
the skin to some degree, and with very little or no downtime. So in the past, where
Wonderful.
we may have done some deep chemical peels and the individual was healing for many, many weeks, some of the newer advancements in laser we can now get done and literally have no downtime.
Wonderful. It's a lunchtime thing, maybe.
That's
I like
exactly
that.
right, exactly.
That's so convenient for everybody who's so busy right now.
Oh, it's so true.
Great. And of course, you do the chemical peels here. You do collagen and Restylane, the Botox as well. That's something that you feature, and that's nice because that kind of is a preventative, isn't it?
It really is. I tell my patients all the time that not only do things like fillers and Botox treat immediately what's there, but they also have the ability to prevent things from getting worse.
Right.
So, whereas Botox relaxes the muscle, just like a piece of paper folds back and forth and you get a crease, well, if we can prevent that folding with a little bit of Botox, well, now we've prevented that crease from going any further. And
Wonderful.
so the same thing applies to the fillers. Much like filling in a crack with some putty, we're
Mm-hmm.
filling in those lines from underneath and preventing that line from getting any deeper. So it's both an immediate treatment as well as a preventative measure.
Right. And what a boost to your self-confidence because when you look better, you look a little younger, you just feel better about yourself.
Well, it's true, and a lot of my patients, they don't want to look 30 years younger. Some of them would, but I tell folks that our objective really should be we just want to maintain. We'd like to look what our age is, maybe a little bit younger,
Right.
but we can focus on doing some things without having a lot of downtime, having some nice looks, and appreciate some of the things that we can do without a lot of risk as well.
Absolutely. And of course, you can help someone with bad acne. I also know vein treatments you can do. So pretty much you just run the whole gamut. In any type of skin issues, you can really help a patient out.
I really feel that one of the nicest attributes to O'Donoghue Dermatology is that we really truly are comprehensive. when a patient walks into my exam room and I open the door, I truly feel confident that I can help them with pretty much everything skin related, whether it's medical, surgical, or cosmetic. I truly believe that we are comprehensive in the way that we can treat an individual.
Absolutely, and it's nice to talk with you. Just me sitting here talking to you makes me want to come to you as a patient because it's so comfortable.
Well, I appreciate that. I think it's important to put a patient at ease. I mean, not everybody wants to spend all day at the doctor's office. Sometimes it can be an uncomfortable experience, and so we do. We try to create an atmosphere that is caring, that's comfortable. As I said before, my staff is very amenable to accommodating most schedules and just making the patient feel at ease.
And that's very important, and ask you your expertise and your opinion on what might make them look a little younger or where they might need some help in some different areas. So
Absolutely.
I like that. And that's just a testament. Again, I wanted to say congratulations. One of America's top physicians you were voted. That is wonderful.
Thank you. I really appreciate that. It's always nice to be recognized for some of the things you do, and that is an award that I've received the last several years, and I'm proud of it.
Well, you should be. And you also should be proud you have your own skin product line, the O'Donoghue skin product line. Tell us a little bit about that. That's neat.
There's a variety of products that I offer. I have so many different conversations with different patients about different products, and so I tried to create a line of products that would work well with all skin types. And so we provide a sunblock with an SPF of 30 that contains titanium dioxide in it. We have a cleanser, a toner, a moisturizer, as well as a retinol product for fine lines and wrinkles. Products that are really backed up by science and truly can help the appearance of the skin.
And that just completes the visit, really. Once you have maybe a procedure done with you, you go home with the products, which helps to continue, you know, the look that you've gone for, you know, and helps to keep that.
Well, it's so true. You know, I think we can see a dermatologist, but at the end, there is some work that we have to do on our part, and certainly providing products that will really work well and when they leave the office, I think is really beneficial.
Wonderful. Well, thank you so much again for having us in your new location just off of 41 on Field Road. This is a beautiful location, so we want to invite everyone out.
Great. Thank you so much for coming.
Thank you for having us. We were at O'Donoghue Dermatology, just off of 41 on Field Road, and we'll see you next time.
Hello, I've been a patient of Dr. O'Donoghue's for several years now. I've had 3 procedures done, my favorite of which is the laser. It lightens brown spots, lessens pores, and also makes my skin feel soft and silky. I follow up with Dr. O'Donoghue's personal products to maintain the results. I highly recommend his practice.
Hi, my name is Haven Beach. I have been a patient of Dr. O'Donoghue's now for 5 years. I really trust his expertise. He's got an amazing staff, a great location. Come in and see Dr. O'Donoghue and you can look and feel as good as I do.